topic is gingivectomy. Now, what is gingivectomy? Gingivectomy is an excisional removal of your gingival tissue for pocket reduction or elimination. So basically, it's a surgical procedure which is used to remove or excise your gingiva in order to reduce the pocket or to eliminate the pocket. Now, what is gingivoplasty? Now, gingivoplasty means reshaping or recontouring of the gingiva in order to attain a more physiological contour that allows for a beautiful, good maintenance of oral hygiene. Gingivoplasty, the tissue is thinned interproximally in order to produce a more harmonious contour with the interproximal slice airways, and then it helps in easy passage of food. Gingivectomy and gingivoplasty are usually performed at the same time. What are the rationale for doing the gingivectomy or gingivoplasty procedures? Again, first would be the pocket elimination or pocket reduction for for pocket elimination for gaining a better access to the root surface, pocket elimination for root accessibility, and to establish a physiological gingival contours. What are the indications of gingivectomy? First thing, it should be you should have suprabony pockets. You should not have any kind of the indications for your gingivectomy procedure include your suprabony pockets, adequate width of attached gingiva, at least 3 millimeters of zone of keratinized gingiva should be present in order to perform any gingivectomy procedure. Your bone loss should be a horizontal pattern of bone loss and not any vertical pattern of bone loss. You should have a gingival enlargement, and then you should have areas of limited access. It's also indicated in unaesthetic or asymmetrical gingival topographical situations, and then for exposure of the soft tissue impaction to enhance an orthodontic tooth movement or to enhance eruption at times, to facilitate restorative dentistry, to establish physiological and gingival contours post your acute necrotizing ulcerative gingivitis and flap procedures. What are the contraindications? When you don't have an adequate zone of attached gingiva or a keratinized gingiva, you don't go to attempt to doing a gingivectomy procedure. And then in infrabony defects wherein you have a vertical pattern of bone loss, again you don't go to attempt doing your gingivectomy procedures. Apart from that, if you have pockets extending beyond your mucogingival line, then don't go to do gingivectomy procedure. Highly inflamed or edematous nature, first control the inflammation and then reevaluate the status. If still the fibrotic content is still left of the gingival enlargement, then you can go about resecting it. If not, don't attempt to do gingivectomy. And areas of aesthetic compromise, wherever you feel that it's going to compromise the aesthetics, then gingivectomy is not the procedure of option. In case of shallow palatal walls and prominent external oblique ridges, then don't do. And then the other contraindications, treatment of infrabony pockets and patients with poor oral hygiene. What are the advantages of gingivectomy? Predictability, simplicity in the procedure, and then ease of pocket elimination, good access, and favorable aesthetic results. The disadvantages include it has to heal by secondary intention, bleeding postoperatively, and loss of keratinized gingiva, and an inability to treat underlying osseous deformities. How do you do gingivectomy? Let's go into the procedure. The pre-surgical phase, first you remove all the local factors, control the inflammation, and then after the initial healing, you measure the zone of keratinized gingiva, and then after adequate local anesthesia, you measure the pockets and make sure that the pockets are not beyond your mucogingival junction. And then also determine the osseous topography in that area by doing bone sounding. And then you do what is called as a pocket marking. The pocket marking is done using a special kind of a pocket marker called as a Crane Kaplan's pocket marker, wherein you have two pairs. You have your left and the right. You have a pair of instruments. You have your left pocket marker and you have the right pocket marker. Now these are used to mark bleeding points which outline the base of the pocket. So you place the pocket marker into the gingival sulcus and then you go till the depth of the pocket and then mark the bleeding points. So if you can see the picture, there is a kind of a tooth-shaped appearance onto the pocket marker which is placed. Now the toothed appearance of your pocket marker will come onto the external surface of the gingiva, and the other side of the pocket marker will go into the sulcus. So now you press both the areas to give your bleeding points. This will outline the base of the pocket. Now once that is done, you decide on what you want to do, whether you want to give continuous incisions or you want to give discontinuous incisions. The picture here shows you very well what are the how do you give continuous incisions and how do you give discontinuous incisions. What is the type of incision that you should give for gingivectomy procedure? Always remember you have